Hello and welcome to The Nation. I'm Jessie Chahal. The Budget 2026, scheduled to be tabled in the Dewan Rakyat on October 10th, will be the fourth edition of the Madani Budget. It is designed to restore fiscal resilience, strengthen economic fundamentals, and most importantly, its aim is to improve the people's living standards. Now, one of the sectors that directly reflects these priorities is healthcare, with growing pressures from an aging population and the rising prevalence of non-communicable diseases, as well as the push for better access across urban and rural communities. The question is, how are funds being allocated and how will that determine the strength and sustainability of our healthcare ecosystem? Now, today we'll be getting insights from two different angles. Up first, we'll hear from Dr. MURALLITHARAN MUNISAMY, Managing Director of NCS, or the National Cancer Society of Malaysia. And a little later, I speak to YB Senator Dr. LINGESHWARAN, Member of the Senate and former Hospital Director, who will also join us with his perspective on Budget 2026 and healthcare. But first up, we speak to Dr. Murali, who's dialing in from Penang right now. Thanks very much, Doctor, for taking the time to be with us. Let's begin with the fundamentals, perhaps. What do you see as the most pressing healthcare priority that the nation must address?
Hi, and always a pleasure to be with you guys. I think it's clear to everyone, and in the past weeks especially, it's becoming more clear that there is an urgent need to redirect more financing public health sector. I think this is a critical area in which there's a big shortfall. We're seeing services suffer. We're seeing, I think, there's a workforce. I think attrition is perhaps the best word to use, and all this is because we are unable to kind of first provide the resources that we need to keep our human resource in place, but also to get more equipment, more centers to be able to provide services in a quick and needful manner.
Doctor, the civil society has called for more transparent and people-centered budget. Of course, this has been something that has been mentioned year on year, but it does seem that now that voice is stronger. From a healthcare perspective, what would truly be a people-centered budget, and what would that look like to a healthcare professional like you?
I mean, leaving alone what a healthcare professional would look like, even if you looked from a person, I think what people want is the ability to access services and be able to do that without me going into financial hardship. And essentially, this means that we need to have a public health care system which is able to cater for those needs. And you put it quite rightly when you were saying that you're seeing a lot more aging population with a lot more healthcare needs. They are older, but they're also sicker. And you're starting to see this kind of big shortfall in terms of the numbers of people that the public healthcare system is able to serve. So if you went for a people-centered budget, the problem is how the first major question is, how much am I going to have to pay out of my pocket to be able to get the healthcare that I... And this, I think, is a big challenge because people are paying a lot more out of pocket. And while they're doing that, they are opting to look for services outside the public healthcare system because the public healthcare system can't cope.
Yep, as we speak about public health care, you've also in the recent past spoken about the unfair practice of charging cancer patients, for example, first-class rates when they move from private to public hospitals. What changes would you like to see in this budget to ensure that there's fairer access, and of course that is with cost as well, that is available or made available for all cancer patients, regardless of where they begin their treatment at the first starting point?
Absolutely. And though the Cancer Society has been advocating for this, I think it's something that's across the board to all our patients, which is something which will be very equitable to our Malaysian population. And increasingly now, with a public healthcare system that very often you see people going to they will go for 1 or 2 procedures or 1 or 2 scans in a private hospital, and then they will need to come back within the public health system. What is now being a big barrier to them is when they actually opt to go for faster kind of access, get a few things done, which ironically saves the government a lot of money, yeah? Because by them opting to do some of the procedures outside, take scans and so on and so forth, it actually saves the government a significant amount of money. But when these people come back into the government system, they're penalized. So when there's a private referral that is now making you transfer, and when you move with this private referral to the government center, they're actually charging you first class rates. I don't think we're earning all that much money from this practice. It's an archaic practice. Our minister and I think increasingly the Ministry of Health and the government has very strongly stated that we need private public partnerships. And this is one big barrier to it. It's causing a lot of hardship to people and financial distress. I don't think it's going to cost all that much. And it's a really good, popular move, which will be beneficial for the Rakyat if the Prime Minister and the Minister of Finance would consider this.
Well, they've also highlighted the inconsistency where children below the age of 7 still need to pay for cancer treatment, while older school children are fully subsidized. So there seems to be some sort of gap here. What's the impact of this policy on families, and how can the government address this?
I think in terms of this is another, if you notice that when you asked your first question, I think we spoke about big healthcare financing, and that's very aspirational. I don't think anyone can solve that in one budget. Make sure that we have good financial stability for the healthcare system. However, two kind of very simple asks which we think are very reasonable, not very costly to the government, but able to really give value and change the lives of people is what I talked about you earlier about the private referral, and second now to childhood cancer. We have maybe less than 1,000 kids diagnosed with cancer every year. Of that, maybe about 40–50% are not of school going age. There's a very quirky system where if you are under school going age, currently you have to pay full prices for care. While once you're school going age registered in a school, they actually get about 90–95% subsidized. So it's a quirk, it's a bureaucratic mistake. Now, the problem is, again, it's something that we can correct, but there's some financial repercussion. But if we can't spend a bit of money for the government to save children with cancer, I don't think there's any other spend that we could reasonably ask for.
Well, rising healthcare costs also, as you've highlighted earlier, that remains a major concern. Where should the government focus its efforts to ensure that there's affordability, especially for the more vulnerable groups?
To be fair to the government, any kind of increased expenditure in healthcare is going to mean that I'm going to need to pull the money from somewhere else. Realistically, to be fair to the Madani government, year on year, every year they've increased expenditure in healthcare, and that's been reflected on the budget. We're getting bigger and bigger budget on healthcare. However, to be honest, we have now been allocated, and I hope it gets slightly bigger this round, is about 40-odd billion to healthcare. What we need, however, is about 80 over billion in healthcare today. And so this additional 40 billion to be put into public spending is going to need to come from somewhere. So although it's an unpopular move, I think, meaning I'm and many other health advocates besides me are advocating for some kind of tax or a social health insurance mechanism or some kind of ring fencing in which we can bring more funding to healthcare overall. If not, we are just plugging leaks in the bucket.
Right. I want to bring up another pain point that has been, under much scrutiny and discussion as well over the year, and that is the Ministry of Health. They've proposed allowance increases for healthcare workers, especially those in more further areas or rural areas. As a healthcare professional, how do you see this move affecting the retention of skilled staff and the overall quality of healthcare delivery?
So I think one thing that has to be very clear to the public as well is there is a change, significant change in today's younger generation. In my time, and I'm not that old of, maybe about 20 years within the healthcare system as a healthcare professional, 20 years ago, people served out of love of nation. People served for a greater good. Today, it's not that it's not there, but there's also other competing priorities. And most importantly, you must understand that there's a lot of economic kind of hardship and difficulty that people have to face when they are being transplanted away from their homes. When we want people to serve in rural areas, we need to incentivize them. Originally, the government spoke about things like we would prioritize them for specialist training. That's not really happening as well. So in this case, I think a financial incentive such as additional allowances for people serving in the interior, I think those will be critical kind of incentivization strategies to enable us to actually have equity in terms of making sure Malaysians everywhere have the healthcare services that they need.
Dr. Murali, I want to thank you for being with us and, of course, for sharing your thoughts. We'll speak to you again.
Absolutely. Thank you.
Well, as we look ahead to Budget 2026, many perspectives remind us of the importance of keeping healthcare fair, accessible and sustainable for all Malaysians. We will be back after this quick messages when I speak to Senator YB Lingeshwaran, member of the Senate and former hospital director. Stay tuned. I'll be right back. Welcome back. We continue our conversation on healthcare in the lead up to Budget 2026. Right now with YB Senator Dr. Lingeshwaran, member of the Senate and former hospital director. Doctor, thanks for being with us. Now, every budget brings new opportunities. Also, that is the hope. For healthcare this year, where do you see the biggest chance for Malaysia to take that right step forward?
For the invitation to join the nation program. Okay, Jessy, what I'm looking at this year, I hope the government will start allocating a bigger budget for our 2026 budget because Malaysia is considered a middle to upper developed country where our OECD have clearly mentioned that we require at least 5% of the GDP to be allocated for the Ministry of Health. And when we see this last year, during the announcement of 2025 budget, they have allocated approximately only 2.5% of the total GDP. So with the 2.5% of GDP, it's actually very difficult for the Ministry of Health to implement so many of our initiatives by the government. Yes, with we can do a lot of changes which will benefit the rakyat as a whole. So I really hope the government will look into a bigger budget. And of course, we cannot, my target, of course, the GDP that OECD have clearly mentioned, that at least 5%, but it's a bit difficult for us to jump straight to 5%, at least gradually, every year, the government should look into increase the budget 0.5% every year, gradually up until we achieve the 5% of the GDP for our country.
We talk about that 5% and we just revisit what you shared. What would this 5% enable the nation to achieve in terms of healthcare delivery and quality of services? There's also a little forecast that we get out of the health minister, who says that Budget 26 will look at prioritizing healthcare upgrades as well as, very importantly, the workforce and its well-being.
Yes, I agree. With the 5% of budget from the GDP, it's very important. Example, first, which is most important, is our human resources. We need to make sure our human resources, our staff, especially doctors, dentists, nurses, and also all our allied healthcare, need to pay well. And so that they need to pay well. And at the same time, a better allowance should be given to them. Recently, there's issues going on, quite a hot issue regarding the on-call allowances for the medical officers. These on-call allowances, I think, for the last 10 years, it's not been reviewed. And currently, doctors who are working on call, where they only paid 9 ringgit per hour, which is much lesser than the Grab driver who are earning more than us. So I really feel with the, I think, increase of the budget for 2026. This will actually help the government to implement the on-call allowance, on-call allowance, which has been promised in last budget. In 2025 budget, the government have promised to increase on-call allowance, but were not unable to do because of the funding that government have problem. I think the total funding that the government need to increase, at least we need at least 144 million ringgit we require to pay and to pay the increment of the on-call allowance for at least 50% from the on-call allowance. So this is one of the most important thing. Second, our medical equipments. For example, North region of Malaysia, at least hospital in northern region of Malaysia, at least 50% of their medical equipments are more than 10 years old and also beyond economical repair. So we need to replace with the new equipments. And so example, other than that, ambulances reason, during my Senate sitting, I've questioned the minister, what is the status of ambulance? I think we have more than 1,000 ambulances are already achieved the beyond economical repair. And we need to replace them immediately. And other than that, of course, our infrastructure of our hospitals, aging clinics. For example, in Penang itself, we have about 6 government hospital, and 4 of it is considered more than 100 years. It was built before World War One. Even today, I just finished visiting one of our hospital in Penang, which the hospital currently celebrated 135 years anniversary, which this hospital was built even before the first car was rolled by the Henry Ford. So all this need to be looked into, especially the medical equipments, allowances, upgrade our infra of all our hospitals.
Yeah, thanks for highlighting that perspective in terms of the aging or the aged infrastructure. But all of the points that you've brought up seems to have gone noticed by the Ministry of Health and the Health Minister himself. But of course, we anticipate what the budget will be like or what it would look like once it's been tabled. But this is an area very familiar to you as you served as former hospital director before. And from your own leadership experience being within the hospital ecosystem and environment, what are the most urgent areas for investment to ensure that patients, and especially those from lower income groups, so that overall there can be quality and dignified care that will be provided for? You've highlighted equipment and infrastructure, but from your own experience and your own eyes, Doctor, where are some of those other gaps?
I first would like to suggest that the government should look into invest in digitizing the entire hospital, especially in the equipments like laptops, computer, and the most important are the network. Because most of the hospital in the government hospital, they are still using manual technique where we have to plug the patient one by one, which really consume a lot of our hospital doctors and also our nurses and so on. So we need to make sure our digitization happens first, where the government should look into purchasing computers, laptops, and the network. Most of our hospital, even I know we are starting, we're already moving forward to digitizing the hospital, but the laptops and the computers has been sponsored by these donors, especially CSR donors, and sponsoring the refurbished laptops and computer, because we are also trying to move. But the government need to look into this first before before we go into fully digitalization, because fully digitalization is the most important, because we can make sure whatever patient who's been clubbed in the hospital and medication was given, treatment was given, whenever the patient goes to the nearest clinic for a referral and so on, their medical history, their treatment, everything will be matching. So this is very important, because especially low income group are solely dependent on public health system. So once it's fully digitalized, I'm sure the public, the low-income people will access the public health without any hiccups. And without digitalization, I'm sure the rakyat unable to benefit the best they can.
We go back to the conversation about human resources you highlighted and the workforce well-being. Now, 2 points here. Beyond allowances, and you mentioned about the hourly rates and so on, what other measures could help to strengthen the morale and improve the working conditions for the doctors, the nurses, medical assistants? And then on the other hand, what powers our primary healthcare are not just the GPs but also the physicians, from physios and beyond. What steps are needed to strengthen that front line?
The first important thing is we have a clear and transparent career pathway. Currently, most of the promotion are based on seniority. So this should be changed. I really suggest that the promotion should be based on the merit base. For example, in a department, we have a senior consultant and also a junior consultant. But once you achieve the grade, before this we call UD 56. So before they go into JUSA level, it will be based, most of the time, it will be based on the seniority instead of the instead of the how much the particular specialist can give service to the people. So the most important, it should be more to merit instead of the seniority. So we need to have the clear, transparent career pathway for all our promotion. And number two, of course, we need to, I think the Ministry of Health is largest ministry in the country. And our state and also federal award should also be given to our medical staffs. And every year we can see that the award, state award and the federal award has been given, but the which been allocated to the Ministry of Health staff are practically low compared to others. So I also would like to suggest the Ministry of Health to recommend more medical staff to be given award in the state and also federal. And the current condition where the numbers of shortage of nurses and also allied healthcare, more spaces and also more intake should be taken so that they can help to fill the gaps, especially the burnout. So all these things that I'm really hoping that will strengthen the morale of our human resources.
Well, here's hoping that the budget or the impending budget will strike that balance between healthcare infrastructure and upgrade, but also how it can empower the workforce. YB Senator Dr. Lingeshwaran, thank you for speaking to us and for sharing your perspective. Let's look forward to the budget, and I look forward to speaking to you again. Well, what emerges from these conversations is a consistent call for healthcare to be people-centered, transparent, affordable and mostly resilient. Budget 2026 is being watched closely and expectations at this point are high. The proposals and reforms discussed will not only shape how we manage healthcare, but how we prepare for the future, whether it's an aging population, rising costs, or the next health crisis. We will, of course, continue to follow these developments as they unfold. In the meantime, don't forget to visit bernama.com as well as follow us on our social media channels for the latest conversations and news. I'm Jessie CHAHAL. Thanks for watching, and do follow us for more in-depth conversations on topics that matter.